Hi, this is Dr. Kurt Woeller for Dr. Trey Katella. We are from Integrative Medicine Academy. The title of this short video is Functional Medicine Mastery Overview. What do you get with this course? So through Integrative Medicine Academy, we have a number of different what are called mastery courses. This particular course, the Functional Medicine Mastery course, is a comprehensive course on the incorporation of functional medicine into your practice. And regardless of what kind of patients you work with, whether that's people with chronic allergies, metabolic disorders, neurological problems, mental health issues, etc., we're all trying to figure out the root cause. And one of the key aspects of functional medicine that also incorporates integrative medicine is doing sophisticated types of lab testing to figure out things biochemically, how things are working from a fundamental functional standpoint, and then incorporate lifestyle changes, dietary intervention, targeted nutrients, etc., to help bring about some resolution to a patient's health issues. And it's a very exciting field. It's always evolving. There's always something new to learn. And we're very happy to be part of that process. One of the things that we're really serious about in our courses, including the Functional Medicine Mastery course, is always thinking critically and always thinking clinically. As clinically practicing physicians, we do this on a daily basis, and it's very important that every practitioner, regardless of training, think about things from a clinical standpoint. It's not just about using a supplement instead of a medication. It's understanding how things work functionally, how things work from the standpoint of things biochemically. And it's also not just about doing a protocol. We talk about protocols in this course, and we have protocols, but when you think critically and think clinically, you'll be able to come up with alternative solutions for patients, because a protocol is only as good until the next person it doesn't work on, and then you have to figure out something else to do. So incorporating functional medicine into your practice takes education, just like anything. That means a willingness to try new things, keep learning, keep digging, using your differential diagnosis that you've been trained in, but expanding upon it, where we start to, again, work with diet, lifestyle changes, foundational supplements, and then incorporate different aspects of laboratory testing, whether it's the organic acid test or doing food sensitivity testing, bringing that information in and then prioritizing interventions, developing programs for patients to help them achieve a new state of health and wellness. So the first module of this course is the introduction to functional medicine. What is functional medicine? How does it work with regards to things like integrative medicine? Understanding sort of the different layers of this approach, and then steps to incorporate it into practice. Module 2 is about the clinical intake, the symptom survey, and this is building upon our ability to do in-depth clinical questionnaire and a clinical intake. And when you learn how to use these symptom surveys, they can really help to unravel, if you will, or at least open up some opportunities for testing and different types of therapeutic options for patients, because you might be dealing with somebody with a gluten intolerance or poor adrenal function. Sometimes these symptom surveys will actually pick up that people are being exposed to biotoxins or have some other kind of toxic exposure. Modules 3 and 4 are broken up into two parts, and this is where we get into functional medicine testing, at least the introduction to functional medicine testing, looking at hypothalamic pituitary adrenal axis, evaluating for gut function, evaluating for GI pathogens, food sensitivity testing. And then we have a module on incorporating functional medicine supplementation, from antioxidants to liver support to omega-3 fatty acids to B vitamins, how these work, how they complement each other, dosing recommendations, routes of administration, even precautions with some, for example. And we talk about a lot of different supplement companies. These are things that we've used and use in our practice. You might have your favorites. Some of these companies are more broad spectrum in what they provide. Others are more niched, where they're very good at certain products that support mitochondrial function or immune function, for example. So we'll get into that. Module 6 and 7 is broken into 2 parts. This is a very big topic, looking at, again, hypothalamic pituitary adrenal axis dysfunction and sex hormone imbalances, including testing, clinical correlation, clinical pearls, test interpretation. And this very much goes back to the heart of functional medicine, which is understanding the chronic stress response, no matter what the stressor is for a patient, whether it's food, environmental, toxins, mental, emotional stressors. There's a feedback that occurs through the hypothalamus, through the pituitary, that coordinates hormonal production from the adrenal cortex. And so when we have imbalances in this system, it leads to immune problems, or it can lead to cardiovascular issues or blood sugar problems. And so again, it might manifest as digestive issues in one person, an autoimmune condition in another, chronic fatigue in somebody else. But understanding how all of this can have a link back to the chronic stress response. Modules 8 and 9 are broken into 2 parts, digestive system imbalances and elimination. Here we get very in-depth into different types of stool testing, looking at parasites, looking at bacterial, as well as candida and yeast infections, and then talking about different treatment options from traditional medications to botanical and other natural remedies. It's very interesting when you start looking at problems occurring in the gut from different pathogens. We often just think that they're only affecting the digestive tract, but Clostridia bacteria is a perfect example that there are certain strains of Clostridia that produce toxins that affect the brain and nervous system. In fact, Clostridia difficile has different strains. Not all of them affect the gut. Some actually produce a chemical called 4-creosol. And the 4-creosol is known to inhibit dopamine metabolism in the brain or nervous system. When dopamine levels are high within the nerve cell, they break down into toxic compounds that can deplete the cell's ability to maintain glutathione levels. It can lead to oxidative reactions. It can lead to neurodegenerative problems. So this is something seen in autism, Alzheimer's, and even Parkinson's disease is being linked now to, in some cases, excess amounts of dopamine within the nerve cell. Modules 10 and 11 is broken into 2 parts about blood chemistry analysis and functional medicine, what blood tests should be performed, how to interpret things from a nutritional standpoint, look at total cholesterol, homocysteine, vitamin D, thyroid hormone assessment, and more. Module 12 is about diet and nutrition, and this gets into different aspects of specialized diets. The specific carbohydrate diet, often used for inflammatory bowel disease, sometimes now being used in small intestinal bacterial overgrowth. The gut-associated and psychology syndrome diet, the GAPS diet, paleo diet. So a lot of information here about different types of diets for different conditions. Module 13 is about detox and elimination, coming back and touching on the fundamentals of gut function, why doing a liver, gallbladder, bowel system detoxification can be so helpful to remove some of the symptom pictures that people with chronic health issues are dealing with. We'll also talk a little bit about infrared sauna, ion cleanse, and other types of detox methods. Module 14 is about mitochondrial dysfunction and why this is important, how it's overlooked very often. Not only in conventional medicine, but many times in functional medicine, people don't have a good grasp of what happens to the mitochondria, and when the mitochondria are having problems, what kind of global impact that can have on the body. Here is where we start to introduce the organic acids test and how to evaluate certain organic acids as a reflection of mitochondrial problems. And so if we think of mitochondria, these are the energy factories in our cells. And they produce a significant amount of ATP, right? And so there's different components of our mitochondria. We have our Krebs cycle. We also have what's called the electron transport chain, which is what's producing most of our ATP. And these systems can be influenced negatively by different types of toxins. So candida toxins, clostridia, heavy metals, toxic chemicals, mycotoxins, even oxalate, something that people often acquire by eating certain vegetables in high amounts, can damage the mitochondria, and certainly nutritional deficiencies as well. So we'll go through aspects of the organic acid test, specifically the organic acids test from Great Plains Laboratory. And if you learn how to identify certain markers on the organic acids, like lactic acid, that's commonly linked to mold exposure, or succinic acid, which is commonly linked to chemical exposure, this will be a bridge for you to learn how to incorporate other types of testing, which is what Module 15 is about, advanced functional medicine testing, talking a little bit more about the OAT test, environmental chemicals, heavy metals, etc. So we'll touch on topics of glyphosate toxicity and certain chemical toxins and even mold toxins, what are called mycotoxins, because these have a significant impact too. Ochre toxin, for example, is carcinogenic, but it can also be immune suppressive. Mycophenolic, coming from penicillium mold, is commonly associated with an increased problem of chronic candida and clostridia bacteria. So a lot of clinical correlation here. And one of the things you have to realize in the world of functional medicine is that when you delve into this topic, it's not going to be very long before you start having people who are showing up at your door needing help who have a lot of chronic health issues. And so staying at a basic level, well, the reality is you won't stay there very long. And particularly with this course, is we're gonna start a little bit basic, but we're gonna go pretty in depth pretty quickly, because you need to get caught up to speed on how to start evaluating people for some of these underlying toxicity problems that they have that no one else has looked for. And then Module 16 is putting it all together. Okay, steps to take and implementing functional medicine into your practice, different suggestions, different practice tips, sort of do's and don'ts of lab testing, and then again, reviewing the core concepts with different case analysis examples. So who's the course for? Well, this course is actually designed for healthcare practitioners, from MDs to DOs to naturopathic doctors to chiropractors to clinical nutritionists. Really any practitioner, whether you're a pediatrician, a psychiatrist, a generalist, a family doctor, okay? It's really open to anyone who's interested in learning more about the principles of functional medicine. As part of our mastery courses, including the functional medicine mastery course, there is a course forum. So it's called a member forum, where you can come on and post questions on a daily basis. We also have pre-scheduled question and answer sessions. These are live events where you can come on and ask questions of us live. And usually through the question and answer session, we'll many times do a case review, do a lab review, and many members who actually take our courses will submit cases to be reviewed as well, which we're happy to do. There is a plethora of course documents. You get the color slides as a PDF of all of the lectures. You get patient handouts, there's office documents, there's supplement and medication protocols, detoxification protocols. So a lot of support documents you'll get as well that you can use, many of them as handouts in your practice. But as I mentioned before, one thing I want you to just keep in mind is we're all about, again, critical, thinking critically, thinking clinically. And so even though we'll talk about protocols, we want you as a practitioner to come away from this course feeling even more confident about how to come up with alternative options for a patient when a protocol doesn't work. Because the reality is There is no protocol that works 100% of the time for 100% of people. Okay, it's only as good until the next person it doesn't work on. And that happens with us. It's going to happen with you. That's just the reality of being in clinical practice. That doesn't mean that the protocols we have and have developed aren't helpful. They often are, and many times very successfully. But we always have to remember that there's going to be that one person where something doesn't fit, something doesn't work. And so we have to come back and learn how to brainstorm and think alternatively. So a number of reasons of why to take this course. One is you can cut out years of training, the countless hours of studying and the thousands upon thousands of dollars that often is required to go to conferences, stay in hotels, the food, the travel, etc. And this is all delivered online. So you get immediate help, as part of the member forum. You have access to us on a daily basis. And you can access this information from any computer anywhere. Plus, all of our lectures are recorded. So even if you miss the live lecture, the recording will be held within the website so you can catch up on it at a later time. We do have some bonus lectures that are pre-recorded that are also found in different modules throughout the course. And then, of course, all of the handout material that you can use and modify for your own purposes in your practice if you choose. So I'm Dr. Kurt Woeller. I am one of the instructors of the Functional Medicine Mastery course. I have been in clinical practice for over 2 decades. I have been a lab advisor for BioHealth Laboratory. I've done clinical consultation for Great Plains Laboratory. I also do a lot of educational seminars for Great Plains Lab. So I speak not only throughout the United States, but internationally. I'm co-founder of Integrative Medicine Academy, and I've had years of practice in autism, working with patients with autoimmune problems, GI issues, as well as neurological problems as well. I'm joined in this course by Dr. Trey Katella. Dr. Trey Katella is a naturopathic physician for over 20 years. She as well did lab advising for BioHealth Laboratory, and she's done online education. She is a practicing clinician, also co-founder of Integrative Medicine Academy, and has years of experience in women's health, hormones, autoimmune diseases, GI problems, etc. For some practitioners who don't have access to lab testing, there is a website called Lab Test Plus that carries the lab tests that we'll be talking about in this course, whether it comes from Great Plains Lab, whether it comes from doctor's data, whether it comes from ZRT Laboratory. The lab tests that we will be talking about, the vast majority of them are also available through Lab Test Plus. If you want to get a sneak peek of those, you can go to labtestplus.com. You can email to labtestplus@gmail.com with any questions. And if you have any general questions about the Functional Medicine Mastery course, you can make sure to read through the homepage of the website at functionalmedicinemasterycourse.com, or you can email us again at functionalmedicinemasterycourse@gmail.com. Again, I'm Dr. Kurt Woeller for the Functional Medicine Mastery course. Thank you.